and we're going to have two sessions now. One which features a discussion among secular partners, not to suggest that they are not people of faith in their own right, but they are not necessarily identified as faith-based organizations, secular partners supporting faith-based action. And then Bud Rock will chair a session on scaling public and faith-based collaborations to serve local health needs. So we'll be looking at both of those. And then finally, as I was saying, both Joanne and Brian will facilitate a resources and sort of transitioning section at the end. So I'd like to turn the session over to John Oldfield, one of my partners in crime here, who has been a key member of the organizing team, both for this meeting, but on a 15-year basis of support on WASH, expanding WASH and WASH in healthcare facilities. John Oldfield is the CEO of the Global Parliamentary Water Network. John, the floor is yours. Thank you.
Great. Thank you, Jean. Good to be with you once again. Not related to my session, everybody's tummy is full. Had some coffee. If you're still hungry now, it's not my fault anymore. So, hey, great. Jean, thank you once again, and welcome once again to all of our online participants from across the globe. My name, as Jean said, is John Oldfield, and I have the pleasure of spending the next 30 minutes with you managing a panel of the significant contributions that secular organizations are making to their faith-based partners, churches, various religious organizations across the globe to accelerate progress on access to WASH in healthcare facilities. Now, I'm going to run through the panel very quickly, and just to keep people awake, they're scattered throughout the room, so maybe your neighbor could be one of our next speakers, so you better stay awake, you better pay attention here. I'd like to, the panel in the order that's on the screen there will consist of Dr. Boris Martin from Engineers Without Borders, Dr. Nancy Gilbert from Transform International. Nancy, why don't you say hi, and Boris, would you say hi, please? Voila. Next will be Steve Warner from Rotary International, Peter Fant from Water Engineers for the Americas and Africa, and finally Dr. Jose Luis Cobos Serrano from the International Council of Nurses. Dr. Cobos, will you be speaking in English or Spanish? Both. Okay. Well, we'll let the interpreters figure that one out. So after each one of our presenters, we're going to try to be, I say 2 minutes, we've all said 2 minutes. We're going to try to set a record here and actually just speak for 2 minutes each. We'll see how it goes. But I'm going to hand the floor over to Dr. Boris Martin from Engineers Without Borders for 2 minutes of introductory remarks. Please.
Thank you. It's really nice to meet you all. Thank you for welcoming Engineers Without Borders USA and myself into this space and into this broad coalition that I'm discovering personally for the first time. In a way, this is my first meeting attending, and I see that there's a lot of people who know each other already. One of the disadvantages of speaking from the seat is that a lot of people have to turn around, so I apologize for that. Allow me to introduce Engineers Without Borders USA as an organization and the global movement of Engineers Without Borders as it's entering into the space of WASH in healthcare facilities. Engineers Without Borders brings hundreds of thousands of engineers from around the world to really realize their personal commitment to community and to building a system that works for everyone and infrastructure that works for everyone. There are 50 organizations around the world now calling themselves Engineers Without Borders, mobilizing talent, engineering know-how at the service of communities around the world. The U.S. organization that I represent is about 10,000 volunteers every year who join the organization, give their time, their skills to multiple projects. We can say yes to community requests about 70 times per year at this rate, the capacity that we have both financially and talent. And we manage about 350 community partnerships and projects on any given year. I'll make a small point about abundance, which is that when there are meaningful problems to solve, there are more engineers showing up. And I'm saying that as an invitation for partnership. I'm trying to give you a sense of what this organization has to offer, because we cannot work alone. We do not never work alone. I'm really offering the capacity of this organization at the service of your mission and the goals that you have in your own contexts. Over the years, a growing number of the requests that we've seen coming to our organization through our partners have been about WASH in healthcare facilities. And so this is work that's been growing in proportion. It is not, we typically do, water systems in communities. We do improved infrastructure, sanitation facilities, a range of things, suspended bridges for improved access. But WASH in healthcare facilities, since 2017, we've supported about 50 healthcare facility retrofit projects, both for water, energy, solid waste management, in countries like Uganda, Kenya, Guatemala, Ecuador, Peru, and Bolivia. Mainly, those are the places where we've seen the most requests. And so I'll make 3 quick points about things we've learned over that time. One, the need and the impact of the work is profoundly compelling to us. And so as you can see in the commitments that we're making, we will be growing our contributions and focus in that area. This is the reason when I'm showing up to this meeting, to make new connections and to understand how we can bring to bear the capacity of Engineers Without Borders USA in that field. 2, that management, maintenance, and repairs matter. It's not enough to just build something well. There's water systems that break down. There's energy systems sometimes that are not reliable. We also work in the maintenance of medical equipment. I don't think there's one healthcare facility that I've seen that doesn't have a equipment graveyard in the backyard, because a lot of equipment gets donated. None of it gets maintained or repaired. It's a visual reminder that operations and maintenance really matters. When it's about water systems, sometimes it's less visible. It's just not, not functional, or it doesn't give you clean water. So we, as a result of that, really, focus on operations and maintenance at the start, and built into the project design, built into the community engagement, so that the people in charge understand the implications of investing in infrastructure, because infrastructure doesn't live sort of on its own. We're also investing in...
Please, Boris.
Say that again?
Last quick point, please.
Okay.
Thank you.
So I'll say the third point, which is that the WASH in healthcare facility isn't just a acute need at the facility level, it's also an institutional challenge that needs to be built by partners at all levels. And increasingly, Engineers Without Borders USA is working with partners in countries to engage with national governments and to understand the resourcing mechanisms at scale to make sure that the sustaining of the systems happens not just from a well-built system, but through a commitment of the institutions involved.
Thank you. Boris, would you please join us up at the podium here as we hand the microphone over to Dr. Nancy Gilbert?
Where is she?
Would you like a microphone?
Where's she? Hold on, you have it?
I have one.
Thank you. Hi, everyone. As I'm sure all of you will agree, a critical aspect of WASH at healthcare facilities is how to sustain WASH systems. This is true for infrastructure. It's also true for behaviors. There's been a recent focus on the economic cost of healthcare-associated infections, HAIs. And for example, in sub-Saharan Africa, this is estimated to cost $8.1 billion every year. And annually in Malawi, where we've been working, where our program is located, it's $246 million every year. And ironically, this is the amount that would be required to bring all healthcare facilities up to a basic standard of WASH services. And even more important, adequate WASH in healthcare facilities would, if in place, reduce the economic cost of HAIs by an estimated 50%. This underscores not only the need for adequate WASH in healthcare facilities, but the importance of sustaining those improvements. So building on the circuit rider methodology, which you'll hear more about later from our partner at the Desert Research Institute, and melding that with an approach called supportive supervision, the program that we call STREAMS provides facilities with a technical circuit rider and a quality of care circuit rider. As a team, these professionals visit 4 or 5 facilities monthly, providing training, coaching, monitoring, train and set up and support WashFit teams, etc. In healthcare facilities, there are hierarchies in place for a good reason. But as a result, we didn't feel it would work well having, for example, a plumber teach and coach and assess a doctor's hand washing. So it was really important that, this might work at the community level, but wouldn't be so effective in a healthcare facility. So the quality of care circuit riders are government environmental health officers. They're knowledgeable of IPC and charged with preventive medicine in the district. Dual circuit riders are a unique combination, and they've proved very effective. And I think I stayed within my 2 minutes.
Well, I trusted you. I didn't even time you. Well done, Nancy. Thank you. Nancy, would you please join us up at the podium here? Thank you. And our next speaker we've heard from a couple of times. I'm going to call him Ambassador Steve Warner. He's with Rotary, but he also runs the Rotarians Water and Sanitation Ambassadors Group. So, Steve, over to you for 2 minutes, please,
Okay.
and thank you.
And I'll talk clearly and slowly, but I'll try to stay within my time. So I work professionally in the WASH sector, but my volunteer work is with Rotary, and Rotary has a large program in water and sanitation and interest and investment. Rotary, though, is very complicated in some ways and very simple. And most of you have heard of Rotary, and there are many Rotarian colleagues in the audience here that have come up and shared that they are members of their local Rotary Club. But there's over 40,000 Rotary clubs worldwide. There's over 1.25 million members, and we're in virtually every country in the world. So there's a huge reach. But there's some caveats because Rotary is very decentralized. So Rotary headquarters, which authorized my comments today, and I'll be happy to share a printed version with you, has endorsed and supported the idea that Rotary Club should be focusing on the WASH for healthcare facilities. So the Rotary commitment is to promote this as something very important to address and look for partners locally and at the regional and national level. And so myself, and hopefully you'll get my contact information, or I can give you a card, can help you connect to a Rotary Club that's close to where your program is situated if you want to develop a relationship. Over the last 5 years, Rotary Foundation, which is based at the headquarters in Chicago area, has invested over $300 million in WASH projects. Unfortunately, one of the drawbacks is we can't isolate out how much of that is specifically for WASH for healthcare, but it gives you an idea of the amount of money. And that is also, though, money that comes from the foundation. We as Rotarians contribute to the foundation, but many clubs do projects without asking the foundation to match their contribution. So the actual investment in WASH is much larger than $300 million if we could get the numbers from clubs. Rotarians are volunteers. They don't like to fill out reports, so it's hard to get an exact number from the clubs of how much they are doing. But the commitment that Rotary headquarters has authorized me to share with you today is that Rotary clubs, Rotarians are going to hear a lot more about WASH for healthcare facilities. We've been promoting it for a few years, and you should get a very good reception if you want to reach out to a local club. It certainly is better if somebody can make that introduction for you. So I can help you with that, and I'm committed to that, and we definitely want to work with you. So, and when Rotary clubs and individual Rotarians get involved with the project, funding can follow, because we're not just there. We want to be involved in the project, but we're happy to invest if our clubs are involved in the project. Okay.
Steve, thank you so much. Please join us up at the podium here. Peter Fant, WEFTA, 2 minutes. Over to you, sir.
Thank you. And I've revised my thinking over the course of the meeting purely because it seems to me all the smart things have been said. So if you heard smart things, I was thinking them at the same time they were being said. So with that, I've been in the water and wastewater business for 40 years. We've had WEFTA for 25 years. But really 10 years ago is when we started working with the Daughters of Charity on one specific project down in Chiapas, Mexico. And after we developed a relationship with them, they asked us, do you guys work in Africa? So that's when we actually added the Africa on the end of our name. And lately, it seems like our name ought to be Water Engineers for the Sisters, because the reality is, that you find the sisters and you're digging into the communities there. But being that part of our talk is supposed to be on the secular businesses, and so wanted to highlight as well that the local businesses, we talk about circuit riding, we talk about working in the communities. You're finding, particularly in sub-Saharan Africa, the people you're working with, the professionals, they're from those communities. They know those communities better than any of us who move around our lives and live in different countries. But that is where they are from. So I think the important takeaways real quick are, is the networking that's needed. We've talked about networking here, but the networking that's needed to help you expand and cover the areas you need to cover. The second one is the sisters, and then the third one is the small businesses. They are the ones that are going to help you take care of the communities.
Right now, it's a tie between Peter and Nancy. Who got closest to 2 minutes? This is tricky. Thank you. Please join us up here at the podium. And last but certainly not least, Dr. Cobos, representing Pop Quiz, 30 million, what? Dr. Cobos, the floor is yours, please.
Okay, thank you so much. Thank you very much. Thank you for inviting me, my organization. Because I have 2 minutes and I want to speak from my heart, let me to speak in Spanish.
Give us 10 seconds, please.
Just to tell you that, as it's been said, my organization, the International Councils of Nurses, represents 30 million of nurses around the world through 140 national associations. We are 140 countries, and it's the healthcare collective which is larger all around the world, the largest one. We have to take advantage. It has a great potential. And I would tell you that the healthcare could not exist without safe water, and we all agree with this. It's quite a simple statement. So all around the world, the nurse take care of people every single day. We prevent infections. We accompany during delivery. We provide cure. We protect communities. But in many situations, we ask to do all this without drinking water, without an adequate sanitation, and without basic hygiene. I would like to highlight that in these times when our world is suffering in areas of conflict, sometimes hospitals are destroyed, healthcare centers, and this entails that our professionals, they don't have drinking water for their own care, and furthermore, for other consequences. This is not just a technical problem, nor has to do just with infrastructures. It has to do with human beings, of humanity. It has to do with that has an impact on the dignity, to the safety, and the quality. Nurses are at the center and in the front line in this challenge. We are the ones who see, first of all, often the infections. We are the ones who know how they work, how things work in the clinical practice on a daily basis. And we are the ones who stay when sometimes the projects finish. During the pandemic of COVID, it was a great example of this. You see nurses putting on, vaccinating people, reorganizing hospitals, and we are prepared for this, well-equipped. You need to take advantage of this. We need to listen to the nurses. You need to listen to the nurses. We have to include them when you have to take decisions. We need to invest seriously in water, in sanitation, in all the healthcare facilities. Nurses are not, we execute actions. We are leaders, we educate, we defend, and agents of change. This is why it's necessary to listen to the voice of nurses. And we will defend, wherever we are, the WASH project because we believe in it. Not as an expense, but it's an investment. It is cost-effective, and this is we need to show and tell the authorities. I think that it's clear the support that nurses can provide in your project, and you can count on us for whatever you think we can serve to the populations and humanity at large. Thank you.
Dr. Cobos, muchísimas gracias. Please join us here at the podium. Now, by my clock, we have 7 or 8 minutes for a very quick roundtable discussion here. Dr. Martin, if I might go back to you. We both hear a lot of conversations in the hallway about the systems approach, and I'm wondering if you might want to elaborate on that. This isn't just engineers building stuff, poking holes in the ground, but Engineers Without Borders USA has a much broader, more holistic approach to your work. And then you can hand over to your surprise next guest here. Thank you.
Yeah, I mean, without repeating a lot of things that a lot of people have said over the past 2 days, I'll say that, for us, it starts with ownership by the right institutions, so engaging with municipalities, engaging with national governments, with faith-based networks that are ultimately the operators of the systems that we build, and then having the capacity to maintain, building the human capacity behind the system. And the third thing is a well-designed, well-engineered piece of infrastructure that supports the community health. And we also take a systemic approach in, someone was mentioning, clean water in the community avoids visits to the healthcare facility. And so building health, like water systems, sanitation in schools, clean water in schools, and then properly electrified and clean water systems in the healthcare facilities. So that's the systemic aspect of our work. But the second point I'll make is that we take a partnership approach. And I did ask, you asked me questions of sustainability and systemic approach. I asked our partners what their perspective is on those questions, sustainable WASH for faith-based healthcare facilities. And I wanted to read a couple of sentences from the responses. Sustainable WASH in faith-based healthcare facilities is not determined by infrastructure quality alone, but by whether the institution can own, finance, operate, and scale the system over time. From our experience with medical bureaus, the key drivers are institutional ownership, predictable operations and maintenance financing, accountable human resources, leadership oversight, integration with government systems. So I'll just leave it there. Oh, my apologies. Well, you made a pitch, Nancy, you made a pitch about the circuit riders. Tell us more about what that is.
Oops. Okay, thank you. Well, I mean, we all know post-construction support is essential to sustain WASH systems in healthcare facilities, and the circuit rider approach is an excellent option. Dr. Eppenberry is going to speak about that in a later session. But I want to focus on those special requirements in healthcare facilities that are different from supporting community health systems, or community wash systems, rather. So we're talking about, the standards of water quality needed for some machinery, for example, separating, managing, and disposing of contaminated waste, as my colleague mentioned earlier. Facility and environmental cleaning is really critical in a healthcare facility, and rigorous and appropriately timed hand washing and use of hand rub. Supporting wash fit teams, all of these are essential behaviors that we need to be supporting. So to guide, coach, and monitoring these behaviors does require a level of technical knowledge and credibility and trust to be effective. And I also really believe that these behaviors need to be reinforced regularly. Our circuit riders go monthly, and I think that's really important, partly because staff move and change, but also we're humans, when we slip. So having that ongoing support is really helpful in sustaining good wash systems. In Rumpi District, Malawi, where we've been working, there are 18 healthcare facilities, 7 are faith-based. We've really enjoyed working with our faith-based, this is a tongue twister, facility partners, and we find them really responsive and dedicated, and that's wonderful. So in terms of commitments, my personal commitment and the commitment of the organization that I represent, Transform International, is to be available to share the knowledge we've gained through 6 years of supporting the STREAM Circuit Rider program in Malawi, and help anyone interested in considering a similar approach or similar program to provide ongoing post-construction support for these essential aspects of healthcare. I have a question for Steve, who's down there. Steve, trust is always important to sustainability, and Rotarians around the world are often highly trusted in their local communities. How might the Rotary Wash Ambassador Program best contribute to the work of faith-based actors and their allies in wash and healthcare facilities?
Thank you, Nancy, wherever you are, but anyway. The Ambassador Program was developed to help clubs connect with resources and partners that are doing WASH. So the goal is, the Rotary has 530 districts. Each district has approximately 60 clubs, and many of these clubs are doing WASH projects. And sometimes, going back to Sister Teresa's question earlier today, they try a project and maybe it wasn't quite as successful as they hoped, but they're committed to improving on it. And so they want to get help, and the ambassadors are the ones that can help them connect to training resources, information online, other partners that they can work with. And so the goal is to, of course, do the best quality work possible, but everybody has to start somewhere. And before the Ambassador Program got started, Rotary was trying to help clubs, but they didn't have the boots on the ground to really help the clubs. And so we don't have an ambassador in every one of our districts worldwide, but we are pretty far along, and we are developing training resources. As a matter of fact, Nancy chairs a committee to help improve the education of Rotarians. And so part of that is also letting them know that there's a whole array of faith-based groups that are already doing excellent work that they can partner with. And while Rotary is a secular organization and non-political, we want to partner with every group that shares in our motto of service above self. So, and Rotary is, I think, best known for polio eradication, and we're very close to achieving this long-term goal to eradicate polio from Earth, but it's proven to be complicated, and one of the complications goes back to conflict. And so in a small stretch of the border between Pakistan and Afghanistan, groups like the Taliban and ISIS were in control, and they did not trust that the polio eradication program was going to do anything but infiltrate their territory. But a Rotary leader in Pakistan, who is very well known, very well respected, was able to broker a meeting and get the agreement from the Taliban. So that is going to help us get to the very last part of our long-term goal, because we went from over 300,000 cases of polio a year when we started this campaign. Last year, there were 35 cases of polio, and they were all in this one area along the border. So, but the problem wasn't so much we couldn't finish the job, it was the fact that, you know, the conflict zone prevented us from doing the work to complete the job. So trust, because of this Rotary leader, there was trust, and that's an example of how Rotary can help and work and wants to work with you. So, and Dr. Cobos, my question to you is about empowerment. You talked about empowerment that you're trying to bring to nurses worldwide, especially in areas where there's a big need for WASH services. And by the way, my son is has a doctorate in nursing, so I think nurses are great. So, but can you tell us how you hope to empower more nurses to help with WASH services in areas of need?
Okay, thank you, Steve. It's a very good question. When I talk about empowerment, is to move from talk or the words to the action. This is very important. A little bit more in Spanish, please. Porque
first of all, when we talk about empowerment, we do not only refer to power. It's a matter of having all the potential of a professional surface out and capitalizing this potential. The potential that nurses can offer is not acknowledged or leveraged enough in the healthcare sector. As a matter of fact, nurses play a fundamental role in helping patients, and actually they are leaders and accountable for these treatments to the patients, and it means that empowering them is providing them some competencies and authoritative roles to take part in decision-making processes. We can plan infrastructures, we can be engaged in committees to counter infections, because we know the daily situation in healthcare facilities. And third, we can forge robust partnerships, especially with the religious-based organizations and communities, as these faith-based communities and organizations do inspire trust. They are present locally, so we can forge cooperation programs with them. Of course, we need formation and lifelong learning and training to foster the empowerment of nurses. Thanks to the many national associations that are so strong and active and distributed in the different territories. That's important. During lunch, we talked about it. Well, you have to leverage us to exploit our potential. And the role of nurses in the WASH project is very important. We can accomplish many things together. Then, Peter.
Lives. Can you please expand a bit on your work with the local businesses?
Thank you there. Working with the sisters, a quote came out when we started, which was, "It's amazing what can be accomplished if no one cares who gets credit." And that goes a lot to the networking, but it also goes to, since we are a small business, if we approach you for funding, we don't care. We work for the sisters. You can have the credit. We don't care. The sisters don't care. We'll give you the credit for that. But the next is that taking care of the small businesses, some of the important parts are, particularly in the political climate now with funding being pulled, you have to adjust. And I'm just telling you this so you recognize, and I think maybe everybody does, but in the communities, they got to be paid promptly. You got to have the money. You can't pull it back. And one of the things we like to do is work with them, try to make those things secure, help them with grant applications to organizations like yours, help them develop their own capacity, bring in resources for them, drones, so they can take pictures and show what we do. But I think that becomes and finally, one more thought, was on the circuit riding. The circuit riders, those are the ultimate small businesses. Those are, one or two people in a community that we need to be supporting, that all get supported by this as they ride around on their motorcycle or however they get around. But that's a big element of what we're trying to do when we support not only the big organizations and the sisters, but the people that are in the trenches doing the work.
Peter, thank you. Was that it?
That was it.
You sure? Hey, listen, the title of this session, thank you all very much. Stand by momentarily. Faith-based organizations and allies who have come together to accelerate progress on WASH in healthcare facilities. These are the allies. These are your secular allies. And each one of them, if anybody was listening, has offered their services. Each one of them is available after this meeting to discuss in great detail the many offers and many commitments they've made. Now, I'm a little bit biased here. This is my favorite panel of the day, heck of the 2 days. But I'd like to give my colleague Bud Rock a head start on his panel, and I'd like us to all stand up and give my good 5 people here a standing ovation. That's mostly that's for their benefit and also just to wake everybody up here a little bit. All right, and you can do the chicken dance like Sister Teresa as well. Thank you, ladies and gentlemen. And Jean, back over to you.
The unbiased opinion of John Oldfield, his favorite panel. Bud, welcome. If you'd like to bring your panel forward, that would be wonderful. Thanks to John. Thanks to all the speakers. You can expect to have all kinds of people responding to your invitations and to your kind offers, and they will know where to find you.